Well, I can tell you that was an event with a high scientific level. There was a result of the work, the research work of our Cuban collaborators here in the South region. I think that is an important event because contributes to the health system of Belize and especially to the health system in the South region because they identify different issues and aspects that are linked with the health system. So I really am glad that we have that event and that result, that we have the presence of the Deputy South Regional Dr. Sahia, Dr. Perlita Dana, the President of Belize Medical and Dental Associates. There are present of different doctors that work here in the South, and of course all the Cuban Medical Brigade, doctors and nurses, that they contribute with their work for the well-being of the Belizean people.
Are you satisfied with their presentation?
Yes, I was really satisfied. I think that all the works, all the scientific research that were presented here has a big value, has a value for the health system. And I really, as I said before to all of the ones that present their works, I congratulate all of them, all that contribute to that result, to that event, and I think that all of us have to congratulate for that event. There is an event that we need to have frequently. That's why the Cuban Medical Brigade every year organize scientific forum in each region of the country.
Today is a very important day because it's the last one conference regional in the locality in PG, Punta Gorda. So the Cuban Medical Brigade made the conference in all the country. So it's the last one. So the very important events. This is an excellent event. So where we have all the people learn in this conference. We appreciate the support of all the managers and all the people that working in the Sur Regional and other person, in this case, and Dr. Perlita Aldana, the president of the Belize Medical and Dental Association.
Yes, today we are holding the Regional Scientific Conference, which is being done by the Cuban Medical Brigade for the region, which means Tancrik and Toledo, Punta Gorda. They do case studies, they review patient care, they review protocols, and they present this in a scientific form. Now, when they present this becomes documents that the Ministry of Health can use as evidence into needs or what needs to be addressed in an urgent manner or what can be addressed by scientific evidence.
These evidence that you're talking about, what are the findings and how do we plan to move forward with these findings?
Most of them might be a protocol or policy that needs to be revised. I'll give the basic example of the transfers. Most of the policies state that if a patient moves on the borderline or alert curves and in pregnancy, they need to be transferred. But then we need to look at broader picture. We need to look at broader picture if these services can be brought here in the district or at a closer distance. Why closer? Because PG is 2 hours away from Dangriga. So we need to probably evaluate the money spent in fuel and transfers, and we can use that to see if it's cheaper to bring the specialists here to us. A special thank you to Ambassador Maria Balaguer, to Dr. Maria Caridad Lopez, the Chief Cuban Medical Brigade for the country, and the organizing team of Punta Gorda and Dangriga hospitals. It's a great success for us to be having this case presentations and this documentation of scientific research. And also to let them know that providing the healthcare service for the people of Toledo and the people of Tancrik is possible through their assistance. So a great appreciation for the support that the Cuban Medical Brigade are giving. Not only doctors, but they also help in the nursing aspect, they also help in the radiology aspect to be able to provide more services to the residents of these 2 districts.